Welcome to Season 5 of AIHA's podcast series, The Healthier Workplaces Show, where we explore timely and informative topics about occupational and environmental health and safety. I'm your host, Alejandro Castillo. Today, I have the pleasure of speaking with industrial hygienist Pam Susi. Pam has over 35 years of experience working as an industrial hygienist in multiple settings, including hospitals, schools, and manufacturing. She also has worked in the construction industry both as a carpenter and as an industrial hygienist. She served as the Exposure Assessment Program Director for the Center for Construction Research and Training for 23 years. She was involved in efforts that led to changes in city regulations requiring use of dust controls during construction work in Philadelphia. Pam is a board-certified industrial hygienist with a Master of Science in Public Health from the University of North Carolina at Chapel Hill. Her research has contributed to changes in the workplace, beginning in the early 1990s with her master's project. After finding elevated methanol exposures among teachers using spirit duplicators, the state restricted the use of methanol-based duplicator fluids in North Carolina schools. Pam established her own consulting practice in 2016 called Avanti Industrial Hygiene and worked at the Pennsylvania OSHA consultation for 6 years starting in 2017. She has co-authored over 20 peer-reviewed papers. Today's episode is part of our Luminary series. We're going to talk about Pam's 35 plus years in OHS and learn about how the OHS industry has changed since she started her career. Pam, thank you for joining us today.
Thank you for having me. I appreciate it.
Let's start from the beginning. How did you discover OEHS and what made you become so interested in this field?
Okay, so I got to go back a little further and just talk a little bit about how, when I first went to college, I had worked a lot through high school and saved up money. And, when I went to college, I had a scholarship and I used all my money up. And I came to the end of my freshman year and I was broke. And so I wound up having to sort of put a pause on the button for college. And I had to figure out, what I was going to do here. And I really was averse to the idea of debt. And so I started thinking like, well, what can I do where I would kind of learn and earn? And over, the next year or so, I sort of figured out, well, maybe I need to try a craft, so I wound up getting into an apprenticeship program with the Carpenters Union. And that way I could, learn. I could go ahead and get a skill. And the way it worked there is every 6 months you would keep getting an increase in pay until finally at the end of 4 years, you'd be up to the journeyman scale. And so I did that. And in doing that, I got some exposure to just how not only dangerous it is, but there's a lot of health hazards, the task associated with the work itself, like, noise, concrete dust, heat, stress, other things that, you come across just in doing your work. But also we would do a lot of construction workers. A lot of people don't realize they do a lot of rehabilitation in industrial facilities while they're still operational. So I got exposed to chemical plants and, smelters and things like that. I remember one time working at chemical plant in Georgia. They used to call it, the locals used to call it a kitty litter plant. But I walked onto the job and all my fellow carpenters were kind of lined up in this weird line and they had their handkerchiefs on their face. And I was kind of laughed because I wasn't sure what was going on. And then as I got closer, I realized what was going on. There's like an ammonia leak or something because couldn't breathe, and stuff like that would happen. And then my fourth year, my last year as an apprentice, I was working at the smelter in New Mexico, copper smelter, and there'd be signs everywhere, arsenic dust causes cancer.
Mm-hmm.
And sometimes we'd be working right over the furnace. You see these red hot flames and stuff.
Of course.
And they gave you a respirator, but that was the extent of the program. You just hang the dirty respirator on a nail in the carpenter shack at the end of the day. But no fit test, no cleaning, no training or anything like that. So I really got exposed to, the health hazards in the workplace. At that point, I knew that I always wanted to go back to college, but I needed to wait until I didn't know at what point. And I knew for certain before I got old and it was going to be really tough. It was already tough on the body, but I didn't want to be out there like in my 40s and 50s and so on. At any rate, I had been kind of getting active in my union. And to be honest with you, I don't know. We'd had a child at this point, and we spent a lot of time in the library. And this was before Google. So I must have been a book somewhere that I
Right.
read about this field of industrial hygiene. And I thought, wow, this is great. It bridges labor, and it also deals with, it's kind of into environmental stuff. Or I thought I might be interested in environmental studies. And this kind of bridges both worlds. And if you want to do something to clean up the environment, what better place to start than inside the fence of the workplace? Because that's where it's, the worst. So I can't say I remember discovering the profession, but I feel like I was sitting somewhere looking at a book or something, like Dictionary of Occupational Titles, or maybe it was a college program. I just thought that would be a great thing to go into.
How do the practical skills you gained as a carpenter work hand in hand with the role as an industrial hygienist?
Like just real basic things like I managed to keep physics at bay when I went back, when I was at college, before I went to get my graduate degree. And then they said, well, we'll let you in, but you got to get physics. And I remember learning about leverage and fulcrums and all that. And I was like, wow, I can relate to this, because I remembered how important a crowbar was,
Of course.
when you needed help. But that was one thing. Some other things were that, I had experience with working inside the construction industry. So when I did industrial hygiene and construction, I had the advantage that I knew the construction trades. And it's like a whole different world there. It's like a whole subculture. So when you get on a construction site and you know the difference between an iron worker and a boiler maker and what they do, it really helps a lot, both with them having patience with you and recognizing that you know a little something about their world, but also in kind of knowing what to expect in terms of what exposures you're going to encounter and that kind of thing. It also gave me a little exposure with working with my hands and tools and that kind of thing, because that I was raised like a girl in the 60s, and I came around about the same time as Barbie did. So I went through a pre-apprenticeship program too, and that helped. But industrial hygiene is more of a hands-on. It's not all hands-on, but you do work with pumps and HVAC systems to some degree. So it made me a little more comfortable, I guess, with that. But I think those are the three main things that came to mind.
For me, when it comes to IHs, they have to have clear communication when working on site. And because you have your experience in carpentry, you have that experience of, again, knowing what you're talking about and, of course, understanding from the other point of view what they understand. How is that communication overall? Like, how did it help you on site?
That's a good point. It helps a lot because there's definitely a certain rapport, and they seem to really respect me more when I came on job sites because I knew something about the industry or the work, and I knew the difference between a brick and a block or
Absolutely.
something really basic, which surprisingly some people don't necessarily know about. But at any rate, that did help. The communication aspects.
Absolutely. Now, your research led to a state restriction of methanol-based duplicator fluids after your master's project discovered elevated exposures in schools. Can you break down the entire process from the discovery to implementing change?
Yeah. So what happened was when I was doing my graduate studies at UNC Chapel Hill, in the summer times I would work, did an internship at Duke University Medical Center. I went over there to enemy grounds, Duke, and and I worked under a really good industrial hygienist, Gary Tenser, and he had done some consulting work for an attorney who was representing a teacher in Georgia who had a son who had some really horrible in utero reproductive health effects. Um, couldn't, was blind, had some neurological effects. And she had been, when she was pregnant with him, she had been using one of these spirit duplicators that uses either very near or actually 100% methanol fluids in them. She had been using the spirit duplicator when she was pregnant with him in preparation of going out on maternity leave, and batched up like thousands of copies. And so he had gone down there, Gary, as part of the work for this as a consultant to recreate what the exposure levels would be based on what she had done, work-wise, and just found really enormous exposure levels, exceeding the STEL easily, in short time frames. And he came back and told Pat Curran, who, is a very respected industrial hygienist, unfortunately passed away a few years ago. And at the time, Pat was the high-level management for the Department of Health, North Carolina Department of Environmental Safety and Health, whatever the title was. And Pat was interested in knowing how bad the problem was in North Carolina schools. And so it turned out about that time I was looking for a master's project, and Pat approached me about doing my master's, doing the work that they needed done, and then I could use the data for my master's project. And my advisor, Mike Flynn at Carolina, was all for that, and so I did that, and it was really fortunate because you had like 3 really good industrial hygienists who saw the value in making all that work, and I was really fortunate because I had the benefit of working with all those people. So what I did was I went to like 5 different schools, and I won't go into the details, but there is a publication, JOEH, it was the Applied back then. I think it got published and made some notes, but I think it was 1996 we finally got it published, but it goes into detail there. But just like Gary found, we found really high levels, like 60%, over 60% of the teachers were well over the STEL in 15 minutes, and over 50%, or very near 50, not over, but approaching 50% of the teacher assistants were over that. So Pat told me at some point after that, he said, well, you should be proud because as a result of your work, we've got the schools taking that off the shelves, or they're, once, I can't remember if it was they took it off the shelves or they got them to no longer, once they used up what they had, they no longer purchased it. And then we also I had the first job I had in DC after I graduated was with a group called the Occupational Health Foundation. They worked with various unions, including the teachers union in New York City. And they also did something similar. They used it because it was very simple machine, very cheap materials. And so it was real reliable. Like the front office would use the photocopiers we see today. Mm-hmm. But those things are very expensive, and they break down a lot. The old little Spirit duplicators, those are really cheap, and they didn't break down much. But they would also use them like in really crazy places, like what was designed as a mop closet or something. And so the lack of ventilation was terrible, But yeah, so that was good. It was nice that there was something good came out of it,
Advanced registration for AIHA Connect 2026 is officially open, and we're heading to one of America's most vibrant cities, New Orleans. Advanced registration is open through March 29th, 2026. Register now for the best rates.
Now, you've worked in a variety of different settings, such as hospitals, schools, manufacturing, and construction. Can you share a story that highlights a difficult industrial hygiene challenge you faced and how you addressed it?
I guess the biggest thing, it's sort of made up the bulk of my work in the 90s and part of the early, what they call the aughts, like 2000, 2010, was when I worked at the CPWR. It used to be called Center to Protect Workers' Rights, but now it's Center for Construction, Safety and Health Research and Training, hence CPWR. It's a big mouthful. But this organization, it's still around. You can Google it, cpwr.com. They do a lot of good work, and they're funded from different sources, but one of the main funding agencies is NIOSH. It's part of a cooperative agreement. And when I was there, we had a NIOSH funding to do a project on just starting out, trying to assess exposure in the construction industry. This was in the 90s. And this was kind of new because at that point, people just hadn't really done much exposure monitoring in construction. They were a lot of concern about safety for good reason, but there wasn't a lot of awareness or attention being drawn to health hazards. Asbestos, maybe. Asbestos was definitely, concern. Even things like silica and lead were getting neglected.
Mm.
So we came up with a what we called a T-beam, a task-based exposure assessment model. And the idea, the whole challenge to doing exposure characterization and construction was that, it's a very transient work process. People were, like you just heard me talk about how I'm in a chemical plant one day, a smelter the next. I was at, airport jobs, different places. But the thing that's constant are the things that you do for your trade, like a pipe fitters, usually always welding or, working around pipe and so on. So what we did was we came up with a model where it created these forms that standardize, kind of split things up by environment, materials, task. We identified, say, we focused on welding hazards, silica hazards, whatever. It kind of focused on the hazard and the trades that were most at risk for those particular hazard. And then we had them in a systematic way, qualitatively define, whether they were working indoors, outdoors, whether there were engineering controls or not, and what type of engineering controls. And then the two defining characteristics of the T-beam method were, one, that we paired up journeyman workers from the trades involved who were the subject of the research with industrial hygienists. And we always were focused on trying to evaluate and introduce an engineering control for that hazard. For instance, silica was a focus. So we had one guy who was a tuck pointer in Boston, and he worked, one of the people on our project was Bob Herrick, who at the time was a professor at Harvard. And Bob, he worked with this George Weymouth, who was a tuck pointer from the bricklayers local up in Boston. And Bob had graduate students that he worked and knew George well, but he would get really good graduate students who would work in the field with George, and they would collect data together. And it was great because George knew how to navigate the job site. And like you said, the rapport and so on really worked well. And then Bob appreciated being able to, have that access for his grad students and himself. And then the grad student or the hygienist, whoever it was, they would work on writing the report and kind of being the liaison with us. We worked with both of them, but, in theory, that's how the model worked. And so I think we published out of that project, we published like 18 different papers, and primarily the focus was on, silica, welding fumes. One thing that spun off that and what we used as the primary vehicle to do research on engineering controls was this group called, it was the NIOSH CPWR Engineering Controls Work Group. And we would meet every year, and I think we met for like 20 years or something like that. But it was really good. We'd bring together researchers, people from the industry, contractors, union people, government people. We'd have like big meetings, and they were very applied research things that were being presented, And when we discover like an issue or problem that in the field, and then like people from NIOSH or, people like from our group, they would take it on, or we'd work together,
That's great. I think having a room full of different specialists, all communicating different problems, that's always a good situation to be in, of course.
Yeah, and it would help NIOSH too, because they needed help with job sites and unions and so on, and that'd be a forum for them to get that help.
Psychosocial Hazards 101, what every OEHS professional should know. Learn more about psychosocial hazards and how you can integrate mental health and well-being into traditional safety programs. Earn 2 contact hours on March 25th. Register today.
Absolutely. Now, for 23 years, you served as the Exposure Assessment Program Director at the Center for Construction Research and Training. How has advancing technology changed the way construction-related exposures are monitored and controlled compared to when you first began directing the program?
Okay, well, the first thing is they're controlled at all, because
Of course.
with lead, when I started working as an industrial hygienist in 1991, that was about the same time that the federal government issued this, huge multi-billion-dollar, a lot of money on the streets. ICE-T, Intersurface Transportation Efficiency Act, put a lot of money into rehabbing the infrastructure, and a lot of lead painted bridges were starting to get painted and rehabilitated, and there was a lot of lead paint exposures, iron workers and painters and so on. And some of these laborers, and a lot of these, I shouldn't say a lot, but some of these guys were going to the hospital like lead poison, really high exposures. And while there was a comprehensive lead standard for general industry, there was no lead standard at all for construction workers. And even the PEL was 4 times that of general industry for construction workers. So, it's really tough out there for construction workers with lead. And then same way with silica, there was really high exposures and no real comprehensive standard for a very long time. So that was a huge difference. Another thing we did with NIOSH, that they developed this technology or used it, was where they did video monitoring and then real-time data gathering and overlaid the real-time bars over the video, so you could use it to kind of see when there were peaks and valleys and so on, and those things. And then we would use that sort of like for training too. But that was sort of like, when we used it back then, it was kind of bulky, it was a difficult process to do. So I don't know if they've gotten to the point where it's a little easier to use, but that I would imagine they have. That would be. And then some of these things, I've never used them directly, but I was somewhere where the virtual reality guy came out, and he had one for like walking on steel.
Oh,
and
wow.
I was with the PA OSHA consultation program then, and my colleague, who was a safety professional, she was like, I had to hold her. I'm like, it's okay, just hold on to my arm. She wouldn't go out there. Like, she really felt like she was on the steel,
How impressive.
Yeah. So that's some good technology for construction anyway.
Let's talk about the city of Philadelphia. Your exposure assessment research helped inform updates to Philadelphia's dust control requirements. Can you break down the entire process from the discovery to implementing change?
I guess it started, I mentioned this fella, Chuck Pointer from Boston. He had mentioned to us about how in Chicago, it was one of the only towns that had a dedicated tuck pointers local. And the tuck pointers, these are the guys you see up on the scaffolding, a lot of times like a swing stage, and they're hanging off like these masonry buildings, and they may be just all day grinding the mortar out of the joints of these masonry buildings. So it's really incredibly dusty work. And we've come to find out that in Chicago, they managed to get some codes in place that help minimize the dust for that trade. We made it part of our research to investigate, how that all came about. And he was the apprenticeship director, I think the training director for this local that was dedicated to tuck pointers. And we talked to him and some other people, and it was interesting. They said that back in the 90s, so the 90s was like the period where, there was no silica standard, but people were starting to become aware that it was a real problem. And a couple of people we talked to said that, back in the early 90s, there was this commuter station in Chicago downtown, and they were doing some tuck pointing work, pointer caulker cleaning, whatever you want to call it. And the commuters would come out of the stations and there's dust everywhere, and they'd be like, this is horrible, and there's a lot of complaints. And so the solution of whoever the owner was, I can't remember if that was a public building or what, but their solution was obvious: reschedule and do the work at night. And so that's where kind of things started. Like, well, this isn't a good solution for the workers, who are doing the work. And so over time, they wound up coming up with the code that said the contractor had to come up with a dust minimization plan. That's really not enough, right? You'd like them to have the controls in place. But as it turns out, because OSHA had come up with a silica special emphasis program, and because the training director of this tuck pointers local knew what they should be using, because through his union, they were doing a lot of training about silica and the hazards and, how to control it and so on. The contractors were on board with, the right way to control it. If there was a dust minimization plan, this is how you should control it. So they sort of chose that route because that was the best way to go. And we actually have a paper there. Guy we work with, Mark Weinstein, who's a faculty member at FIU in Florida and Miami. If you Google his name, you can find an adoption of LEV for tuck pointing. Based on that, what we learned, we formed this silica outreach group for Philly, and we had a fella who was the OSHA labor liaison. We had city government. There were some good folks, industrial hygienists who headed up risk management, and we had air management, and forget the full title, but they're the ones who regulate environmental standards, EPA standards in the city of Philadelphia, air pollution and so on. And we were there, and then we had a fellow named Don Anderson, who was the business rep for the tuck pointers in Philadelphia. And we met like over a 2-3 year period, and we started off by presenting our research that showed how high the exposures were and what controls we'd studied and what worked. And they showed us, told us, well, this is what regs we enforce and this is the process and so on. And over the course of time, by the end of the process, they said, well, we've got 2 avenues we can go. We can come up with a guideline, and that we can do like, tomorrow practically, or we could do, or we can do a regulation. But that's a process where, you have to go before a board, and there has to be a comment period and this, that, and the other. And if we do that, that's going to take longer. So we should, do the guidelines. But it was really good because they said, well, help us find other regulations and send it to us. And, we said, oh, yeah, fine. And we emailed it right away. And they said, could you gather a group of contractors? Because we'd like to hear from them what they think of a regulation.
Of course.
Because they're the ones who are going to have to implement it. And we want to hear from them if they think they can and if it's going to be too much of a burden. So Don, who was the bricklayer rep, he said, done. And we had a meeting. There were like 16 contractors there, and you had it at the bricklayers hall. And so their codes are actually stronger, in that they require a dust control notice that has to be posted, and they actually have to give it to not only the occupants of that building, but to people surrounding that building. It's like they specify like 4 doors down from the left and right of the building, 7 doors down. I don't know how they come up with that formula, but it includes, what your plan is going to, what when they're working, what they're going to be doing, what their control is, and the phone number for AMS, Air Management Services, that's what it is. So if they're not doing what they should be doing, it's easy for the person in the public to call them and say, hey, they're not, obeying their own things. And then they have work practice rules, like, if you're cutting, grinding, and doing any kind of mechanical disturbance of concrete, you have to either use the local exhaust ventilation according to the manufacturer's requirements or what they, specify, or wet methods. So that was now, of course, I didn't realize this, or obvious. It should be obvious, but they regulate public health, so it's work that's done outside the building.
Of course.
Yeah. So, but you figure if someone's got, if they're doing work outside and using these tools, they're probably going to use them inside too. So, but then it was a good, that's a lot of work, and these guys had the highest exposure. So it was good achievement. And it just kind of shows you that if you've got a lot of well-meaning people who really are trying to solve a problem, and they've got the expertise, the willingness, and the ability, like they're in the right position, to make things happen. So that worked out good. That was nice.
Now, as we look toward the future of OEHS, what advice would you give to professionals starting out in the field today?
Okay, well, first I would start off saying that there's just so much to know, and then it can be a little overwhelming, but just remember that, you're not expected to know all of it top of mind, that it's more important, the important references and where to go to find things, and to, build your network of people who are particularly knowledgeable in certain areas, and hang on to their email addresses and phone numbers, because, you're going to be calling on them. That's one thing. Another thing is to make sure and, attend conferences and webinars, listen to webinars, and do whatever you can to kind of just keep that continuing education going. And if you can, if you have access to data or information that, you and your colleagues can collaborate on to present at conferences, or turn into a publication, it's a little bit of work, but do it. It'll be worth it. It keeps you kind of good at your game, and it's good for our profession to have that into the body of literature. So, that's something to try to do. The sooner you do it while you're still fresh out of school, the easier it'll be.
Absolutely. Pam, thank you so much for joining us today.
Oh, no problem. I appreciate doing it, and I appreciate you hosting it.
That wraps up today's episode of the Healthier Workplaces Show. To learn more, visit the AIHA website and follow us on social media. Thank you for tuning in, and as always, remember that healthier workplaces mean a healthier world. Until next time.